Hello students and welcome to our channel. That day I have discussed about the syllabus of ESIC. So today we are going to discuss sample questions. The questions may come in your exam, the types of question, how to answer the questions, how to eliminate the multiple choices. So today we will focus mainly about those things. Okay. So uh, if you want to join my class, no, you need to check my description. I have given the details of joining of my class in my description, so you can join in my class and you can enjoy, you can learn more things regarding your comparative exam. Okay. So uh, today we will discuss the, not only today, each day na, we are going to discuss the 5 questions. Okay, 5 major questions, and as per the questions we also discuss the choices, multiple choices. In suppose here A B C D is there, so according to the choices what will be the things need to learn, we will discuss. Okay. So if you want to get more knowledge, more learning process through my video, no, you need to join in my class. Okay, whatever. So today I will start my first question. First is, the emergency department nurse is assessing a client who has sustained a blunt injury to the chest wall. Okay, blunt injury to the chest wall. Which findings indicate the presence of pneumothorax in this client? First of all, if the question came like this, no, we have to find out the main point in the question. One is blunt injury, second is pneumothorax. Okay. Okay, in the blunt injury, no, there is two type of trauma. One is blunt trauma, second one is penetrating trauma. In the blunt trauma क्या होता है ना, during blunt trauma the foreign body of foreign material, no, not go inside our body. It will make a wound in our outside of the body. Suppose a person is trying to injured by a knife. Okay, but it not invade our tissue layer, not invade our cells, and not went in our body cavity, but it create wound outside of the body, outside of the skin layer. Okay, this is called the blunt injury. And what is penetrating injury? Penetrating injury is defined as the when a knife or any object will go inside in our body and can damage our body organs. Okay, I think this is the clear. So the question is, which findings indicate the presence of pneumothorax in this client? 4 options is there. Okay. First is a low respiratory rate. A low respiratory rate. The low respiratory rate in case of blunt injury, if it is happen or it is hamper in our chest wall, we may have the breathing difficulty. We may have the breathing difficulty. So if we have the breathing difficulty, there is no chances of low respiratory rate at that time due to the blunt injury. Fine. So we need to know na, how to eliminate the multiple choices to find out the actual answers. यहाँ पर टोटल 4 ऑप्शन है. So in case of any comparative exam, no, for the nursing, no, you need to find out the, or we need to eliminate the wrong answer from the given choices, because यहाँ पर ना डायरेक्टली ऐसा क्वेश्चन नहीं आएगा कि सपोज आपका ब्लड प्रेशर, एक एग्जांपल, ब्लड प्रेशर इज नॉर्मल रेट इज 120/80, then second choice may be given 140/100. Like this, no, they will not ask you. They will give the options which is correlate with each other. Okay, so that you are going to become confused. See, first option is a low respiratory rate, second is diminished breath sound, third is the presence of barrel chest, And fourth is a suckling sound at the site of injury. A suckling sound at the site of injury. No, so here, uh, see, a low respiratory rate. Normally, in the blunt trauma, there is difficulty in breathing. So, in the difficulty in breathing, there is the less chances of low respiratory rate. When our breathing difficulty is there, no, there will be the respiratory rate will be increased. Third point is the presence of barrel chest. The presence of barrel chest is mainly found during the COPD patient. In case of COPD patient, no, you can found the barrel chest due to the expansion of a chest wall. Due to the expansion of the chest wall. Fourth one is a suckling sound at the site of injury. Actually, the suckling sound at the site of injury is mainly found during the penetrating injury to the chest. What is penetrating injury to the chest? But here they mentioned the blunt injury. So we can avoid the first point, third point, as well as the fourth point. Here, second point is diminish the breath sound. Diminish the breath sound. As the patient is having pneumothorax, there will be the chances of diminish the breath sound if there is sustained blunt injury. But remember one thing, if there is sustained penetrating injury, at that time, number D, option D, a suckling sound at the site of injury will be the correct answer. Okay. So we will proceed to the second question. So in the exam, no, they will ask like this question only. So you need to identify the actual answer. You need to identify how to eliminate. You need to know how to eliminate the options. No, like this, you need to what to say. You need to know the elimination process of the MCQ. So let's forward to the second question. Second question is, the nurse is caring for a client hospitalized with acute exacerbation of COPD. Okay, which findings would the nurse expect to note on an assessment of this client? Select all that apply. Okay, so the question is, the nurse is caring for a patient who is having COPD. Okay, second is, which findings would the nurse expect to note on the assessment of the client? Means they are asking, if the patient is having COPD, what are the major findings you can find during the assessment? Okay, so you can see first option is a low arterial partial pressure of carbon dioxide level. Second is a hyperinflated chest noted in the chest X-ray. Third is decreased oxygen saturation with mild exercise. Fourth one is a widened diaphragm noted on chest X-ray. And fifth one is PFT shows increased vital capacity. So you need to remember two things here. The patient is having acute exacerbation of COPD, and second one is you need to identify or need to find out the uh, exact symptoms or exact findings during the assessment as a nurse. So in the first point, there is a low arterial PCO2 level. See, in this question, no, we need to identify, we need to know the symptoms. Basically, we need to know the symptoms of COPD. See, in case of COPD, the patient may have the hypercapnia. The patient will have the hypercapnia due to the accumulation of old carbon dioxide here in the lungs. Okay. So when carbon dioxide will accumulate in our lungs, no, there will be the increased PCO2 level. There will be the increased PCO2 level. So the first option, they have given a low arterial PCO2 level. So by this we can eliminate the first option. Second is a hyperinflated chest noted in the chest X-ray. a hyperinflated chest noted on the chest X-ray. See, in case of COPD patient, as I told, the old air or carbon dioxide related air accumulate in our lungs, no, so that our chest will expand due to the hyperinflation of the lungs. Our chest will expand due to the hyperinflation of the lungs. So we can consider this second point is a correct one. Let's see, there will be chances of more than one option which is correct. Okay, so we need to read out each and every point. Third one is this decrease oxygen saturation will mild exercise. Decrease oxygen saturation with mild exercise. See, if there is accumulation of carbon dioxide in the lungs, there will be the chances of there will be the decreased inhalation and exhalation process. I mean, there will be the decreased vital capacity. There will be the decreased vital capacity of the lungs. So, if the vital capacity of the lungs will decrease, by the time our oxygen saturation also decrease in our body. By the time our oxygen saturation also decrease. So we can consider the third point also the correct one. Fourth one is a widened diaphragm noted on chest section. No, in case of COPD, as I told that there will be the barrel chest. We can found the barrel chest due to the expansion of our lungs. We can found the flattened diaphragm on the chest X-ray. We can found the flattened diaphragm on the chest X-ray, not the widened diaphragm. So by this we can consider this D, option D was the wrong option. And last one is PFT shows increased vital capacity. So I already told that in case of COPD patient, vital capacity will decrease. That means the oxygen saturation in the body will decrease. By this we can tell that PCO2 level will increase. So see, each and every point no is interrelated. So you will not get very easy option to find out the correct one. So you need to read out all the options to find out the correct one, because in the competitive exam of our nursing, no, they may give you more than one correct option. So you need to read, you need to identify the correct one. Okay. And third question, see, the nurse is assessing a client with multiple trauma. Okay, the patient is having the multiple trauma. Okay, who is at risk for developing acute respiratory distress syndrome. Okay, the nurse should assess for which earliest sign of ARDS. See, there is two main points. As I told, in each and every question, you can find the main point, main terminology. So you need to find out the main terminology. Here, one is multiple trauma. Second one is acute respiratory distress syndrome. Okay. In case of ARDS, what happened? In case of ARDS, no, first, as soon as ARDS progress in our body, no, our respiratory rate will increase. Dyspnea will be there. Breathing difficulty will be there. If it carries out without treatment or unresponsive treatment, it will carried out with the intercostal retraction. Our intercostal muscles will retracted. After retraction of intercostal muscle, there will be a chances of wheezing sound or crackle sound in the lung sound, and there will be the chances of any abnormal lung sound like crackles and wheezing. So in case of ARDS, no, in case of ARDS, first is there will be the breathing difficulty. There will be the breathing difficulty. If there is breathing difficulty, ultimately the respiratory rate will be increased, and it proceeds towards the intercostal retraction. If the respiratory rate will increase more than normal, if the breathing difficulty is very high, at that time our muscles will try to get enough oxygen, to get enough saturated oxygen from the air, so that our muscle getting retracted, and at last it will proceed to the wheezing sound, crackle sound in the lungs. So what is the question? The nurse should assess for which earliest sign of ARDS. Basically, they are asking the progression of sign and symptom during the ARDS. Basically, in this question, they are asking the progression of sign and symptom during ARDS. What is the first or earliest symptom during the ARDS? So you can get that it is the increased respiratory rate. Other than this, will come later on. Fine. The fourth question is, a client with a chest injury has suffered flail chest. Okay. The nurse assess the client for which most distinctive sign of flail chest. There is two terminology. First one is flail chest. Second one is distinctive sign. So the flail chest. What is flail chest? Flail chest is nothing but it is a type of rib fracture. It is a type of rib fracture where more than three ribs will get fracture. Where more than three ribs get fracture. Remember one thing: rib fracture and flail chest may be same, but there is one difference is there. Rib fracture means one ribs also get the fracture, two ribs also get the fracture. But in case of flail chest, it should be three rib fracture or more than three rib fracture. Okay, so there they clearly mentioned that there is more than three rib fracture happen due to the chest injury. Fine, and remember one thing: in the flail chest, no, the main rib fracture will be occur in the floating ribs. As we know already, there is three types of ribs in our body, in our chest. First is true ribs, second is false ribs, and third one is the floating ribs. So mainly the floating ribs will get fractured during the flail chest. Okay. The nurse assess the client for which most distinctive sign of flail chest. So they are asking which is the most prominent sign during the flail chest. Fine. So how to eliminate the options over here? See, they are asking most prominent sign. Most prominent means if the person is having this sign, it will indicate the flail chest like this. Okay, like you can say in the what to say any like McBurney point pain. McBurney point pain. It will indicate the appendicitis. So there is there is a pain may be there in the abdomen, but if the pain is having in the McBurney point, it will indicate the appendicitis. Like this, the distinctive sign is there, which is indicate the flail chest. See, they have given first point is cyanosis. Cyanosis can indicate many diseases, many symptoms. So we can by this we can eliminate the first option because they are asking the distinctive or accurate sign or actual sign of flail chest. If the patient is having cyanosis, so he may have the flail chest, he may not have the flail chest, he may have having any other heart disease, he may have any peripheral vascular disease. Okay, so we can eliminate the first one. Second option is hypertension. So hypertension can person is having hypertension may have any kind of disease, may have cardiac disease, may have any renal disease. Okay, so various types of disease may have. So hypertension we can eliminate because hypertension is not the prominent or indicative sign of flail chest. If the person is having hypertension, he may have the flail chest, he may not have the flail chest. Okay. Then paradoxial chest movement. What is paradoxial chest movement? Paradoxial chest movement means the abnormal chest movement. The abnormal chest movement. What is abnormal chest movement signifies over here in the flail chest? See, whenever no, the floating ribs will fracture during inhalation. When we will inhale the air, at that time no, the floating ribs will go inside in our what to say, the floating ribs or the flail ribs will go opposite to the our chest expansion, opposite to the chest expansion. See, during inhalation no, we are expanding our chest, but our ribs is going to expand, but at the same time the fractured ribs will go opposite to the flail chest, opposite to the other true ribs and false ribs. This is it clear? I again repeating this part because it is very important. If there is any fracture in the ribs, okay, so when we are taking breath, when we are taking oxygen from the air, our chest will expand, but the fractured rib will not expand. It will go inside, go opposite toward the expanded chest. Okay, when we will exhale, the same thing will happen. The fractured ribs change his direction. The fractured rib change his direction means it will again go opposite to the normal ribs. So remember this thing only. If the patient is having fracture in the ribs, the movement of the chest will differ from the movement of the broken ribs. Will differ from the movement from the broken ribs. So we can clearly see that there is the abnormal chest movement. There will be the abnormal chest movement. So abnormal chest movement is paradoxial chest movement. By this, we can consider this number C option is correct. Number C option is correct. Fourth one is dyspnea, especially on exhalation. Dyspnea, especially on exhalation. So dyspnea may happen in any disease condition. No? Dyspnea breathing difficulty is there, so it should not be distinctive sign of flail chest. So if we can consider the third one as the distinctive sign of flail chest. Okay. Fifth one is the nurse is assessing the respiratory status of a client who is suffer for fracture rib. See, I have given first one is flail chest, second one is fracture rib. So there is the difference. I already told. The nurse should expect to note which findings. Means if the patient is having fracture rib, which findings nurse should expect. First, they have given slow, deep respiration. Slow, deep respiration. So, slow, deep respiration will not see if the patient is having the fracture rib. So, he must have the breathing difficulty, no? So, there will be no chances of slow respiration. The respiration will increase. The respiration will increase. The respiratory rate will increase. So, by that, we can eliminate number one. Slow, deep respiration is the incorrect option. Second one is rapid deep respiration. Rapid deep respiration. So in the number B point, rapid deep respiration, we can consider that if the patient is having fracture in the rib, he may have the breathing difficulty. So breathing difficulty may lead to the rapid respiration or rapid or increase the respiratory rate. Third one is paradoxical respiration. Paradoxical respiration. See, paradoxical respiration is related to paradoxial chest movement, which is related to flail chest. So if there is fracture in the rib, if the number of the ribs is 3 or more than 3, we can consider the answer will be the paradoxical respiration. But if there is one fracture rib or two fracture rib, we can consider here the rapid deep respiration. So I can clearly told you already, try to differentiate those 2 points, frail chest and fracture rib. If the patient is having frail chest, he will be having the paradoxical movement of chest, abnormal chest movement, and abnormal chest movement will lead to abnormal respiration. Second thing is fracture rib. If there is fracture, one or two rib fracture in the chest, so there will be the no paradoxical respiration, because paradoxical respiration will having in case of flail chest only. So here we will consider the rapid deep respiration. So by this third portion we can eliminate. And last one is pain, especially with inspiration. Pain, especially with sorry, inspiration. So whenever no, I told already during fracture rib, when rib will fracture, when we will take inspiration, during inspiration no, the fracture rib will go inside. The fracture rib will go inside. At the time of chest expansion, at the time of inspiration, our fracture rib will go inside. Okay. So when the fracture rib will go inside, it will hamper our tissues. It will hamper our cells, so that feel pain. We feel pain. Okay. So sorry. So number D option also correct here, because during inspiration the fracture rib will go inside and damage the cells and organs, and we can feel the pain. So we can tell that number B and number D is correct. Sorry, number B and number D is correct. But here one thing is happening. See, if the patient is having fracture rib, he may have rapid respiration, but he or she uh, deep respiration, he or she may not have, because deep respiration and rapid respiration togetherly is having during the bronchial asthma or in case of COPD or in case of COPD. So rapid deep respiration, if the only option will be the rapid respiration. We can take the number B option as a actual correct option. But I told we can consider the number B previously, because if there is D option is not there, if the D option is wrong, at that time we can consider the number B. But if there is pain, especially with inspiration, this point is there, we can consider number D is the actual and correct answer, because in case of fracture rib, the patient may have rapid respiration. The patient will have the rapid respiration, but patient may have rapid deep respiration, may not have rapid deep respiration. Okay, so we'll consider the number 4 point, pain, especially with inspiration. So today we discuss these 5 questions. I think you will learn something from these 5 questions. By these 5 questions, I also discuss many things related to this question. No? So if you want to learn more such questions, more such knowledge, you need to know, you need to join in our class. So if you want to join in our class, you need to check our description box, and you can easily contact with me, and you can join our online classes. Remember, this is totally online classes, and it is for any nursing competitive exam. I will discuss one by one, each and every point in our paid online classes. Here in YouTube, I will discuss 5 to 6 questions maximum in a day. But in our online classes, we will discuss bulk of questions, bulk of solutions will be there, on bulk of knowledge we can get in my through my class. Okay. So hopefully you like my video. So if you like my video, you can subscribe my channel. You can click the bell icon also, and kindly give write in a comment box what you want to know. What is your if you have any confusion, you can share in my comment box. So you can write in the comment box. So till then, अच्छे रहो आप लोग, इससे पढ़ाई करो, अपने नॉलेज एक्सपांड करो. Career is the first priority. So give concentration on it. Thank you so much. Till then, have a nice day.